The broadcast is now starting. All attendees are in listen-only mode.
Welcome all, and thank you for joining us in this webinar on the Meeting for You Stage 2. My name is Mohammed Farhan, and I'm one of the Meeting for You coaches here at MTBC. I also have a co-presenter, Kashif Mahmood, who is also a Meeting for You coach.
Hello, everyone.
This webinar is about Stage 1 changes and Stage 2 requirements of the Meeting for Use. And in today's webinar, we will show you how MTBC can help you plan and adopt MU Stage 2 measures. Before we get into the details, let me first begin by telling you that you have joined this session on the GoToWebinar service. You can see a GoToWebinar panel on the right-hand side of your screen. This service allows you to ask questions using the GoToWebinar panel. And if you need to minimize the panel or get it out of the way, use the arrow key that is pointing towards the right-hand side of your screen. This will minimize the panel and will allow you to see the screen as much as possible. If you want to ask a question at any time, there is a question section of the GoToWebinar service. You can go ahead and open up the question section at any time, enter your question, and submit it. And we will try to answer all of your questions at the time they are asked or at the end of the session when there is time for questions and answers. And if you were not able to get to your question during this webinar, we will respond to you by email. Slide 3. Let me also tell you a little about our company. MTBC is in business since 1999, and we have clients in the 35 unique specialties in 43 states across the country. We have more than 1,000 employees, and we have 24/7 operations, and our technical support is available 24/7 to help the clients for all our products and services. We are Microsoft Gold certified partner, and we have been among Deloitte Technology Fast 500 company for the last 4 years. We are also a SureScript certified solution provider. All of our EHR applications are also ONC certified, which means that they will surely help you achieve your Meeting for Use intended. In today's webinar, we will talk about the Stage 1 changes, 2013 and beyond. We'll also give you a brief overview of the Stage 2 core and menu measures. And we'll also show you how MTBC has developed both its products to accommodate the changes and how MTBC has or is going to incorporate different requirements into its certified EHR technologies, which is MTBC Web EHR and MTBC Desktop or Cloud-based EHR. We will also give you a brief overview of MTBC modules and products that can help providers meet the new robust requirements in 2014 and beyond. In the Stage 2 final rule that was published in August last year, Center for Medicare and Medicaid Services announced several changes in Stage 1 EHR incentive programs. These changes took effect on October 1st, 2012 for all eligible hospitals and critical access hospitals, and on January 1st, 2013 for all eligible professionals. They are categorized as required, removed, and optional. And I'll now give you an overview of the Stage 1 changes that are applicable from 2013 and beyond. The first change is about the public health reporting objective. Now, this change clarifies that provider must perform at least one test of their certified EHR technology's capacity to send data to the public health agencies, except where it is not allowed. This is required in 2013 and beyond for all Stage 1 public health objectives. This means that if the providers are allowed by the state to submit the data electronically using their certified EHR technology to the public health agency for the public health reporting objective, they should do so even if it is not required by either law or the practice. If the test of the submission is successful, providers should start regular reporting with the body with whom the test was conducted. We'll move on to slide 6 and talk about the objectives that are no longer required in 2013 and beyond. The first change that is no longer required in 2013 and beyond is about electronic exchange of clinical information. Beginning in 2013, this objective for electronic exchange of clinical information will no longer be required for Stage 1 for all eligible professionals, eligible hospitals, and critical access hospitals. Stage 2 will include a more robust requirement for electronic health information exchange as a part of the objective for providing a summary of care record following a transition of care or referral. Also, there is another change which is about the clinical quality measures. This measure is also no longer required as a separate objective for reporting ambulatory or hospital clinical quality measures as a part of the meaningful use. But it is important to note that all eligible professionals, hospitals, and critical access hospitals will still be required to report on these clinical quality measures in order to achieve the meaningful use. Center for Medicare and Medicaid Services is simply removing the standalone objective that requires providers to attest that they plan to report on clinical quality measures. There are also a few optional changes in 2013. We will go ahead and start with the computerized provider order entry. For this particular objective, CMS has added an optional requirement, which has also been incorporated in the MTBC EHR already. In the previous years of meaningful use, providers were required to enter medication orders in the EHR using the CPOE for 30% unique patients during the reporting period. But in 2013, providers can also report on 30% of total medication orders. So that's not unique patient anymore. Provider can still report on the unique patient, but they also have an option to report 30% of the total medication orders instead of unique patients. And the alternative measure will be that more than 30% of all the medication orders created by the eligible professional or providers of the eligible hospitals during the EHR reporting period are recorded using CPOE. We'll now move on to the next slide. The next Stage 1 change is regarding the vital signs objective. There is an increase in the age limit to record the blood pressure. The age limit has been increased to 3 years from 2. Also for height and weight, the age limit requirement has also been removed. So the patients who are 3 years and older, only their blood pressure has to be documented, and height and weight should be documented for all the patients regardless of their age. Slide 9. And here we will talk about another change, and that is exclusion in the vital signs. If an eligible professional does not see any patient 3 years or older, or if all 3 vital signs are not relevant to their scope of practice, but if height and weight are not relevant to their scope of practice, then the eligible professional would have to record the blood pressure. Or if blood pressure is not relevant to their scope of practice, then the eligible provider would only record the height and weight. Previously, all the eligible professional could only apply for the exclusion if all three vital signs had no relevance to their scope of practice. Now they have two more options, and that is number one, sees no patient 3 years or older that is excluded from blood pressure, recording the blood pressure. Number two, if a provider believes that all three vital signs of height, weight, and blood pressure have no relevance to their scope of practice, is also excluded from recording these vital signs. Or if he believes that height and weight are relevant to their scope of practice, but blood pressure is not relevant, then he can also go ahead and apply an exclusion. If he believes that blood pressure is relevant, but height and weight is not, then he can go ahead and apply exclusion for height and weight. We'll move on to the next slide, which is about the electronic prescribing. All eligible professionals who are not within a 10-mile radius of a pharmacy, they can go ahead and apply an exclusion. So if they have no pharmacy within the 10 mile of their office, they can apply an exclusion. So APs at the start of their EHR reporting period who do not have a pharmacy within their organization or one within their the 10 mile of their practice that accepts electronic prescriptions, they can attest with an exclusion for this objective. Next slide, please. As we also discussed in our previous webinars, that earning meaningful use incentive requires eligible professionals to meet a minimum set of objectives, which are 13 core or mandatory objectives and 10 menu objectives in stage 1, of which a provider has to choose 5. And these together are going to make them a meaningful user. But it is important to note that every provider has to participate in stage 1 of meaningful use for 2 years, regardless of the year in which they started the meaningful use. But except for those who started in 2011, all such providers who started in 2011 will have to be in stage 1 for 3 years before they go on to stage 2 in 2014.
Please bear with us.
I'm sorry, there was a disturbance. So I was telling you about the provider's participation in the EHR and Clinic program. It is important to note that all eligible provider has to participate in stage 1 of meaningful use for 2 years, regardless of the year in which they started the meaningful use, except for those who started in 2011. All such providers who started in 2011 will have to be in stage 1 for 3 years before they go on to stage 2 in 2014. So if you started in 2012, you will participate in stage 1 in 2012 and 2013, and then move to stage 2 in 2014. All those providers who start in 2013 will remain on stage 1 even in 2014, because as we mentioned, every provider will have to participate in stage 1 for 2 years. So 2013 participants will be on stage 2 in 2015. I'll now hand over the mic to Cash, who will walk you through the meaningful use stage 2 requirements for the EHR incentive programs.
Thank you, Farhan, and thank you everyone for joining this webinar. I shall start with the Medicare payment schedule first. Now, as mentioned earlier, by Farhan that those providers who started meaningful use and completed their first attestation in 2012, they will be requiring to meet the Stage 2 objectives in order to complete the attestation in 2014. The maximum incentive amount they will earn will be $4,000 from the total of $44,000, because those who started in 2012, the total incentive amount was $44,000. Now, those eligible professionals whose first attestation was completed in the year 2012, they will also fall under the Stage 2 in year 2014. So both who did first attestation in 2011 and those who did the first attestation in 2012, both of these providers will be falling under Stage 2 in the year 2014. And for those who completed the attestation in 2012 can earn the maximum incentive amount of $8,000 from the total of $44,000. Now, the eligible professionals who already have completed their first attestation this year, in the year 2013, or are in the process of completing the attestation this year or in 2014, will still be meeting up the requirements of Stage 1 in 2014, means that they will still fall under the Stage 1 in 2014, and the incentive amount would be a maximum of $12,000 for those who will be doing in 2013, and also for those who will be doing in 2014 from $39,000 and then to $24,000 as the maximum incentive amount. Moving on to the next slide. Let me also remind you about the penalties. Now, those providers who haven't started a meaningful use yet, the last year to participate in the meaningful use is 2014. And they have to complete the attestation before October 2014. If they fail to do so, Medicare will start penalizing them in 2015, initially with 1%, 2% in 2016, 3% in 2017, and after 2017, the penalty will be 5% of the total allowed Medicare charges. So that indicates that it's really important to start participating in the meaningful use incentive program before it's too late to avoid the penalty. We should go to the next slide now. And let me also give you an overview of the meaningful use of Stage 2. Starting in the year 2014, those providers who have met Stage 1 for 2 or 3 years will need to meet the meaningful use Stage 2 criteria or objectives. Now, regardless of the participating year, all providers need to perform the meaningful use for a 90 consecutive days reporting period in 2014. That is mentioned in the Stage 2 final rules. The Stage 2 objectives are more focused to improve patient care through better clinical decision support rule, care coordination, and patient engagement. Now, that will result in better clinical outcomes, increased transparency and efficiency, and more robust research data on health system. Moving on to the next slide, it will basically show you the framework of different stages of meaningful use. Now, in terms of the different stages of meaningful use, the first stage is about capturing and sharing of data that requires electronic capture of health information in a structured format. Stage 2 is about advanced clinical processes that requires quality improvements at the point of care and electronic exchange of information. And Stage 3 will provide improved outcomes that are in terms of improvements in quality, safety, and efficiency in clinical decision support rule and patient self-management tools. Moving on to the next slide. If we compare Stage 1 and Stage 2, we can see that in Stage 1, there are 15 core objectives and 10 menu objectives. Out of 10 menu objectives, the provider has to opt for 5. Whereas if you see in Stage 2, the core or mandatory objectives have increased to 17 objectives, and the menu or optional objectives have decreased to 6. Now, in terms of menu, Stage 2, 6 out of 6, the provider has to opt for 3. Now, later in this webinar, we will also show you what the core and menu objectives are for Stage 2 and how they can be achieved using MTBC certified EHR. There are also certain changes for eligible hospitals, like instead of 14 core objectives, in stage 2 they will have 16 core objectives, and out of 10 menu objectives there will be 6 menu, out of which the providers have to opt 3. Going on to the next slide. So the stage 2 requirements are actually the expansion of the basic stage 1 criteria. Some of the objectives, like the access of patients to view or download their health information, clinical lab test results, generating the list of patients by specific conditions, education resources, medical reconciliation, and immunizations registries are the many objectives in the stage 1. But for stage 2, they have been moved to the core objectives or the mandatory objectives. Again, we will look into more of these objectives in the next slides. Going on to the next slide. Now, a lot of providers will be thinking or are concerned that the final rules of stage 2 have been already issued and are going to be implemented in 2014. So what is the MTBC's progress in this regards? Well, to answer this, meaningful use experts working here in MTBC, the research analysts, and the MTBC's IT team are proactively working to get the stage 2 certification for both of our products, which are the web EHR and the desktop or the cloud EHR. A pilot testing of our products was also done in the first quarter of this year, and most of the measures have been cleared, and remaining have been developed and are being testing for quality assurance, and will be tested and approved by ICSA labs by the end of this year. Moving on to the next slide. Now, earlier I was referring to that we will also show you what the different core measures are in stage 2. So here you can see a complete list of all the 17 core measures of stage 2, and also their mapping with MTBC's products, web EHR and the desktop EHR. So if you look at the first objective, that is the computerized provider order entry, or CPOE, that can easily be met by simply sending the electronic prescription or documenting the active medication in the patient's charts in our EHR. Second objective is about electronic prescriptions, and that can easily be met by using MTBC's electronic prescription module in our EHRs. The third objective is regarding documenting the patient's demographics, and that can be met by recording the demographics data in the personal tab of the MTBC's certified EHR, where normally the demographics of the patients are updated or documented. If you go down to the fourth objective, that is regarding vital signs, and that can be met by documenting the vital signs details in the patient's charts in our EHR. Fifth objective is about the smoking status, and it can be met by updating the smoking status under the social history in the patient's chart. Sixth objective is about the clinical decision support rule, and we are in the process of updating this module according to the new standards, and again, that will be done by the end of this year. If you move down to the seventh objective, the core objective, that is to provide the access to the patients to view or download their health information. Now, MTBC has patient portal where the patients can get themselves registered and can easily access their health information. If you go down to the eighth objective, the eighth core objective, that is to provide the clinical summaries to patients for each office visits. Now, that can be achieved either by giving the access to the PHR, the personal health record, to the patients, or in the EHR, we have the capability to export the documentation in a continuity of care document or in HL7 format that you can send electronically to the patient, or you can basically export it in any format and you can give it to the patient for their, just for them to view that. Going down to the ninth measure, that is to protect the health information. All of our products requires a user profile. There should be a username, there should be a password in order to get into the system, plus one of the users also have the administrative rights, which means that that administrator can also limit the access to other providers or to other users where where they can basically look into that. Now, we're getting questions regarding if there will be a copy available for this presentation or for this webinar or not. Yes, once we'll be done with this webinar in about a couple of days, we will also be showing you the links by the end of this webinar where you can actually see this webinar available on our website, or for those who really need to have a copy of this, we can also send it through email. Now, going to the other measure, that is measure number 10, incorporate clinical lab test results into the certified EHR. Now, even though we have integration with different labs across the country, but the provider can also create orders and incorporate the results manually in our EHR. For the objective number 11, that is to generate a list by the specific conditions. Another good thing about our EHR is that it has the capability of generating the reports as per the user requirements. So at any stage, whenever you need to pull any kind of a report, depending on any specific conditions for quality improvements or for any of your research purpose, you can basically pull it up by using our EHR. You can customize your reports, you can pull it up, and then you can further do a research based on certain quality improvements or any kind of an outreach. Another one is number 12, that is the clinically relevant information to identify patients who should receive the reminders. Again, that can be done by generating the reports using our EHR. Maybe there is any preventative or follow-up care required for any kind of a patient, like for a comprehensive physical exam and so on. Any kind of those reports, any kind of an alert can be created in the EHR, and certain reports can be pulled through which you can reach out to your patients. The objective number 13, that is to use the EHR technology to identify the patient-specific education resources. Now again, for a couple of these points, this one and the point number 15, to provide the summary of care record of each transition. We are still in the process of updating this module according to the new standards. Like we do have the module created, but we are trying to update it to the new standards, and will be done by the end of this year. Going down to number 16, that is to submit electronic data to immunization registries. Now, those who already are doing the meaningful use stage 1, who already have done that, we already have submitted those registries successfully, and the same goes to for those immunizations. They can use our EHR, and at the back end, we will basically be submitting those registries to the local health department. And the last measure is about, or the last objective is about the use of secure electronic messaging to communicate with patients. Now later in this EHR, we will also be showing you certain modules that have been introduced to help the patients for better communications, and that can be done through PHR. Means there will be a two-way communication between the providers and the patients at any stage. If there is a need for the patient to communicate with the provider, or if the provider needs to communicate with the patient, it can easily be done through PHR or through our software. So in other words, all these requirements can easily be met by switching to our EHR and documenting the details in the patient's charts. Now, by doing so, the least that you can achieve those objectives will be 90%. So that is a pretty significant number. Just by using our charts, you can easily achieve your meaningful use stage 2 objectives. Going on to the next slide, that is in terms of the menu, or the menu objectives or the measures. The first one in this term is, now once again, there are a total of 6 of these menu measures, but the providers have to opt only 3 out of the 6. So the first one is basically to submit the syndromic surveillance data to the public health agencies. That can be done through our EHR. Whatever you will document, it can easily be submitted to the health agencies. The second one is to record electronic notes in patient records. So the charts option that we have in our EHR, you can simply record any kind of a notes in the patient's charts, or you can search it, you can modify it for future references and so on. Another option is for the imaging results that can be accessible by using our EHR. Then yes, using our EHR under the documents, it will give you the option to either to scan or to attach those images directly into our EHR. So this means that at any stage, you can go ahead and you can simply scan the documents, or you can attach it under the documents option, and you can get over with this measure by simply attaching it under the patient's account. Then is to record patient family health history. That is in terms of the structured data. You can achieve that simply. We will be creating a module that is still under process where you can simply document that structured format. Another is to identify and report cancer cases to state cancer registry, and identify and report specific cases to specialized registries that are other than the cancer registries. So both of these modules, we are still in the process to update them, and it is expected that by the end of this year, they will be up and running before the implementation of stage 2. Moving on to the next slide. Now, to meet the meaningful use requirements, whether stage 1, stage 2, or stage 3, MTBC has developed a meaningful use dashboard which is user-friendly and allows the provider to keep a track of their meaningful use progress at any selected reporting period. Now, stage 2 measures will also be updated under the same dashboard. On your screens, you can now see what that dashboard looks like. Now, at any stage, you can pull any kind of a report, like depending on your 90 days reporting period. You can select your dates. It will give you a real-time progress, and now it already has an updated 2013 changes, and like I said, that it will also have the option of stage 2. The provider can pull the report in real time and will get to know about their progress, each of these objects. So it will give you how far you are done, what are the requirements, who are the patients that you need to work on, would you go for an exclusion, if there are any exclusion for these points or not. Each and everything will be available under the same dashboard. Going to the next slide, number 23, that is the Care Connector. Now let me introduce a very useful module that MTBC has developed by the name of MTBC Care Connector. MTBC Care Connector is a suite of integrated patient engagement services which automates administrative tasks to facilitate better practice management and helps practices achieve greater operational and financial efficiency. Care Connector provides patients with many self-service options. Now with that, a practice can not only reduce administrative costs, but also empower patients to become more engaged consumers. Care Connector is also designed to meet the growing requirements in stage 2. Now we suggest and recommend that you should engage your patients as early as possible so that the requirements of stage 2, like secure messaging, accessing their health information, downloading and transmitting the electronic health record, can be achieved easily. Now, the Care Connector basically comprises of personal health record, or the PHR, that allows the patient to access their personal health records available online. iPHR is a mobile application which allows the patients to access their personal health records from their mobile devices. iCheck-in, a fully integrated application which automatically reads patients' insurance card, takes their picture on the spot, and allows them to make payments with their credit cards. Automated Alerts, a communication service which facilitates the scheduling of preventative care encounters like flu shots, well visits, and also appointment reminder calls and balance reminder calls. There's also a 24/7 toll-free patient help desk that is established to help your patients if they face any problem. Your patient can also call MTBC absolutely free of charge with any billing-related questions they may have. So this is a pretty useful module that MTBC has created that will also meet the stage 2 requirements and will basically streamline the activities in your office that will have more efficiency both in financially and in operational matter. Going on to the next slide. I would also like to go through with some of the important MTBC's core services that are offered in conjunction with Stage 2 requirements. The first one is our certified EHR that allows you to document the charts, to record each and every detail about the patients in order to meet the meaningful use. For e-prescribing, we also have developed the iPhone application, which is MTBC IRX. That means that you can also electronically prescribe using your iPhone. Another important core service is the MTBC Business Intelligence Module. As most healthcare organizations pursue the Accountable Care Organization model, or the ACO, and struggle to comply with meaningful use regulations, business intelligence tools are becoming more imperative. Meaningful use Stage 2 regulations already mandate analytical and predictive business analysis. So the MTBC's Business Intelligence Module will analyze data and integrate information from all aspects of healthcare organization to provide you with a thorough analysis of your practice, financial, and operational health so you can make informed decisions. Moving on to the next slide. Now, another important core service that I would like to highlight is the chart Scribe service. Now, provider can send us their digital audio dictation, and MTBC will transcribe their complete patient charts that will help the providers achieve their meaningful use objectives. So, like our objective is to help our providers to achieve the meaningful use incentives as much as they can. So, for that purpose, we also have introduced the chart Scribe services. You can simply send us your dictations, and we will be working on your charts. We will be working on most of your meaningful use measures, and we will try our level best to make you ready for the attestation and to earn your meaningful use incentive. Going on to the next slide, that will basically be giving you the summary what we actually have covered in today's webinar. The first thing that we discussed was the changes in Stage 1, what Stage 2 is all about. We talked about the MTBC's products development to meet the Stage 2 requirements, how core and menu measures will be met through MTBC's EHR. And we also talked about MTBC's different products, core services, modules developed to help the providers meet the meaningful use objectives. If you need to know more about Meaningful Use Stage 2 or any Meaningful Use incentives, you can log on to the CMS website. That is www.cms.gov/EHR incentive programs. I'll repeat, that is www.cms.gov/EHR incentive programs. You can also get some useful resources on our website. You can log on to www.mtbc.com/meaningful-use.aspx. Again, that is www.mtbc.com/meaningful-use.aspx. For any questions or comments, you can send us an email at mucoaches@mtbc.com. Again, that is mucoaches@mtbc.com. Or you can contact us at 732.873.5133, extension 308. A video of this webinar will also be available on our website, normally in about 2 business days, and you can log on to www.mtbc.com/webinars.aspx. That is mtbc.com/webinars.aspx. As mentioned earlier, now you can use the webinar panel to ask any questions if you may have. We will not take a short pause to get the questions that are already been asked, and we will try to answer as much as we can. So please hold the line, and we'll be back. Thank you.